Back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mele. We're talking about breast augmentation and the very latest in breast implants. Later, we'll be taking your calls, answering any questions you might have. Here's the phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And our caveat, any advice we give you today, you'll certainly want to consult your own physician as well. Let's just jump into the I promise pictures, but
sure.
Let's jump into the phone lines for a second here. I've got Laura from San Jose. She's got a question for you. Hi, Laura.
Hi.
Good morning.
Good morning.
Hi. How are you?
Great. You got a question for Dr. Mele?
Yes, I did. I had surgery on my right breast, and I had a fibronomia taken out of me. And I was just wondering if it will affect the fact that if I have breast implants, if it will affect my right breast.
You had probably a fibroadenoma, which is a benign growth within the breast tissue. So normally that doesn't affect the placement of implants or the use of implants. The biggest challenge will be is if there's a change in size. So if one side is a little bit larger than the other, then we may need to do something to use a different size implant on that side that's smaller, or sometimes even a different profile or shape. So I think if you've all healed up, the best thing to do is see a board-certified plastic surgeon and get an opinion from them whether they can do a good job for you or not. But I don't think that alone should cause trouble.
So, doctor, I mean, that leads to the question, some people ask if they have the breast implants, does that make it harder to detect possible growths?
It should not. Most of the time when we're putting breast implants in, we're going behind the muscle. So the muscle still has the breast tissue out in front of it. So in terms of physical examination, very simple to still check the breast.
Now, mammograms are pretty harsh. I mean,
that's what I hear. I hear a lot of complaints about mammograms. But with the mammograms with breast implants, it's important to let your mammogram technologist know that you have breast implants. They will do an additional view, which is an oblique view, to try and pick up that breast tissue that may be blocked by the implant itself. Because the implants we can't see through. And the other thing is that they usually will do it on a day when the radiologist is there. So if there's an area they have a question about, they can do mag views, they can check it more closely. And certainly as MRI becomes more popular as a way of screening, the implant shouldn't interfere with MRI at all.
Okay. We promised we'd show some before and after pictures. Let's go ahead and roll those and take a look at, and these are with the brand new FDA approved.
No, actually, they're so new that I like to have pictures that are out a year.
Right.
They haven't been out a year yet.
Right.
So,
okay.
But this will give us an idea. This is someone who has you can see kind of a prominent chest plate at the top. And in that case, it's actually good to use a round implant. So I've used a round implant in this case and got a nice tapered appearance because of the shape of her chest.
So it actually now matches. It doesn't
matches the profile of her chest.
Yeah.
So for her, even though she has relatively a small amount of breast tissue to start with, a round implant behind the muscle still gives a very nice tapered view.
Okay, and it does look natural as well. Okay, next picture.
So in this case, you can see the chest plate's a little bit different. It's prominent sort of halfway down. So as we put an implant in that position, it kind of exaggerates the fact that there's an implant there. So we go from chest wall to implant, and it looks more round. And again, many people like that look. They want that fullness up at the top. They like looking like they have a push-up bra on.
Yeah.
And a round implant will do that. Well, a tapered implant might not.
Now, not all breast implants are made alike, and not just the materials that they're made out of and the shape, but I mean, you actually try to fit them to the chest so that it looks like it belonged to the person's torso.
And thankfully we have those options now. We have some choices. Still, we can't really make a custom implant for each chest, but at least we have variety in terms of volume and shape, width, projection, all those things. And now with these new implants, variable projection from top to bottom.
Okay,
now this is not the new implant, but this is a saline implant that's the same shape. And with the saline implants, we can also push out that lower pole more than the upper pole, which again gives us that tapered teardrop look without the roundness up at the upper pole.
Because in nature, really, I mean, isn't that the way it falls?
Well, especially if someone's taller. And if someone like this lady is 5'10", the chest tends to be a little longer, lengthwise, than it is widthwise. If we have an implant that's a little bit taller than it is wide, it kind of makes sense, and it kind of fits better.
We've all seen the pictures of the extreme cases of the breast implants that are put on, say, someone with a really small chest, and then there's a large round implant, and it comes out the side, and then you see some other...
Yeah, the term is side boob. Yeah.
Okay.
Some people actually come in requesting that, and they want to look overly full, and it's something I tell them. I said, if you want to do that, you can, but there are risks, and the risks of going larger than your body type are higher risk of needing a lift in the future. You're going to stretch out that skin more, and it's going to be pretty obvious that something was done.
Okay, what about the gap in the middle? What causes that?
Gap in the middle, we have some control over that with the width of the implant that we use. If we use an implant that's too wide, obviously it pushes out to the side too much. If we use one that's too narrow, then we're getting a bigger space in between the implants.
Boy, it really is about aesthetics. I mean, you want
It's
to,
all
if you're
about
going to have this
aesthetics.
done, you want to go to someone who understands all the nuances.
Sure, and there are some things I can't control, like the shape of the ribs are the shape of the ribs. We're not going to change the shape of ribs in order to change the position that the implants sit in.
Okay, well, I need to take a quick break, but for more information about Dr. Mele, you can call him 925-943-6353, or check him out on the web at either drmele.com, sanfranciscobreast.com, or at sanfranciscoplasticsurgeryblog.com. When we come back, we'll finish our discussion about implants and take a look at some other examples, and we'll take your phone calls. Stay with us.